Thanks, Count Corla. 6 minutes, Count Corla, maybe in 4 minutes for statement and answers. Can I begin, Count Corla, by expressing condolences to all families who have been recently bereaved because of COVID-19. A heavy price continues to be exacted on our population. Also, on behalf of the Regional Group of Independents, I wish to applaud the efforts of our national medical and clinical care staff and wish full and speedy recovery to those diagnosed in hospital or in home care settings at present. Minister, can I highlight some areas of innovation, potential and ongoing COVID management which I hope your office can acknowledge and seek to give support to? PPE in development in Ireland at present has no expedited access or pathway to gain certification or standards approval so that it can be formally supplied to public, community or national health services. I am presently aware of 2 projects in Waterford attempting to navigate to standards approval. The first is a barrier face mask, the design of which has already been approved for use in France by means of a standards reclassification, but as yet in Ireland we have been unable to accelerate standards consideration. The second is a new clinical full face mask being developed by the South Eastern Applied Materials Research Centre at Waterford Institute of Technology, one of our 15 national technology gateways. Development is in conjunction with University Hospital Waterford ICU consultants, Boston Scientific Concert and Javel Healthcare. This mask may prove a significant development for clinical care leaves protection, and again, Minister, I would ask for your office's support in coming weeks to assist certification of this product. For information, Minister, the SEAM Technology Gateway at WIT is assisting some of the foremost names in medical device design and manufacture in the country. Their 3D printing facility has been manufacturing face visors for local healthcare concerns since the COVID outbreak began, and I would ask your department to support the release of approved funding granted in 2018 for the purchase of a CT scanner for industrial X-ray. This apparatus is needed to support the innovation and problem solving that has been second nature to many businesses in Waterford and the South East for many years. Minister, can I move to the issues in our nursing and residential care homes? The situation regarding PPE has been well flagged, but there are broader issues which I believe have not. Some social and political commentary possibly infers that we have substandard nursing care prevalent in our community and residential care settings. I know this to be untrue in my county of Waterford. What is puzzling to me and to many others is why your department and the HSE have not prioritised senior care staff to handle the testing requirements within nursing homes. Testing kits could be made available to nursing staff along with short training to allow in-house swabbing of residents and staff as required and sent to local laboratories for analysis. This could deliver a 24-hour test turnaround, the gold standard we are presently failing to deliver. Beyond this, we have vulnerable patients with dementia where clearly having familiar care attendants conduct swabbing would be far more appropriate to their needs. You have directed also, Minister, that HICWA conduct inspections re-COVID activity in residential care settings. Many nursing homes have drawn up current COVID management strategies in collaboration with HICWA already, and any further reviews should be minimised to a desktop exercise to prevent individuals accessing care homes and potentially introducing infection. Your department's announcement of funding to the sector was positive, Minister, but some of the actions of the NTPF to date, who you appointed to administer monies, have been less so. Many care homes have expended significant resources in the purchase of PPE, increasing staffing numbers, creating COVID isolation areas and protocols, and bonusing staff payments to cover enforced absence of colleagues and the increased workload. The NTPF applications to support funding are onerous in the extreme. The decision by NTPF that significant preparatory purchases and expenditure in the month of March cannot be supported is unjust, Minister. Capitation money is only payable on fair deal residents and not those privately funded. Bonus monies that have been agreed or paid cannot be supported. For many care workers, the COVID PUP payment would return more money than their weekly take-home pay. The state is prepared to support this cost, but is not prepared to support an incentive to allow staff work extended hours in these most difficult conditions. The truth, Minister, the truth is, Minister, Government are not adequately compensating our residential care homes for the financial hardship that COVID management has caused, and at this junction neither is it providing the extra personnel resources promised that could be switched from hospital settings. Regarding testing, Minister, significant progress has been made in securing additional test kits through the efforts of Drs Paddy Mallon, Paul O'Brien and Oisin O'Connell. Can we have a status update on that, please? Also, a national training scheme for PPE donning and disrobing would be of immense help in reducing COVID cross-contamination in hospital and in community settings where COVID exists. Have you or your department any plans to address this? Pulse oximeters have been shown to have significant diagnostic value in identifying the early signs of COVID infection and signalling treatment. I applaud the leadership in your department and HSE has taken in this area, which, as profiled in an article in the New York Times this week, may significantly assist COVID diagnosis and early treatment. Finally, Minister, in other medical services area, the single cath lab at University Hospital Waterford was scheduled for refurbishment this year. It has been closed since the 14th of February for a refurb programme scheduled to take 15 weeks. At present in Waterford, the main cath lab and the temporary contract diagnostic cath lab are both closed to service, while a reduced offering is available at the Whitfield Private Hospital. Will you, Minister, give a commitment to authorise works to begin on the existing main cath lab at UHW and to be expedited as an essential service? The UHW cath lab configuration delivered over 4,000 patient procedures last year. Can you also indicate a final recommissioning date and the recommencement of both fixed and modular cath lab activity at UHW? And in addition, Minister, the build of a second permanent lab at UHW, announced by your department in September 2018, has still not gone to build tender approval. There will be many companies interested in this government contract. Will you confirm that monies are ring-fenced to support this capital project and that your department is committed to advancing that as soon as possible to construction tender award? Can I ask, Minister, that you deal with the issues of the cardiac care service firstly in your responses? Thank you.
Deputy Shanahan, Minister.
Deputy, and I know you've done a huge amount of campaigning and work in relation to cardiac services in the South East, and I want to acknowledge that and congratulate you on your election. In relation to the second cath lab in Waterford, absolutely. Money is ring-fenced in relation to that, and I'll get you a status update, Deputy, in relation to that. Whilst it's not for me, obviously, to police what is essential or non-essential in relation to construction works, we have obviously an exemption for essential works to continue. I would have thought the refurbishment of the existing lab was an essential work, and I'll certainly raise that directly with my department and with the HSE, and I'll revert to you, Deputy Shanahan, in that regard. I know how important and sensitive that issue is for the people of the South East. In relation to the projects that you've highlighted, it's clear the South East is a very innovative place, because you've obviously highlighted a number of projects underway where Irish companies and Irish industry are eager to help and support our national effort. I'd very much appreciate a note on those projects, which I'll then ensure are given to the Office of Government Procurement, and that any assistance that can be provided by our state agencies will indeed be provided. In relation to the issue of testing, the point you've made about in-house swabbing, for want of a better phrase, is indeed a valid one. It's one I know the National Public Health Emergency Team is looking at. At the moment, we're largely using the National Ambulance Service, and mainly for reasons of speed. What we want to do very quickly here now is try and find as much of this virus as we can in our residential care settings, so that we can quickly move to try and break the chains of transmission, as we seem to have largely done so far in the community. But your point is valid in relation to the fact that many nursing homes would have the clinical ability through experienced nurses to carry out in-house swabbing. In relation to the issue of HIQA and their visits to nursing homes, I want to assure you, as I've assured nursing homes and as I've spoken to HIQA, about the purpose of these visits are to be supportive. It's not to catch anybody out. It's to visit both public and private, voluntary and otherwise, residential care facilities, nursing homes and the like, and to actually engage and see, look, what's meant to be happening here, is that happening? And also the supports and the connectivity for supports is meant to be in place, is that happening as well? So that we can have more than the anecdote in terms of what's going on, and actually see very clearly from the regulator as to areas that are going well. And I hope to be able to report that many nursing homes are going well, because I believe people are working really, really hard in them. And we do still have to remember the majority of our nursing homes are still thankfully COVID-free, which is some achievement for them. This is a highly infectious virus, and it takes an awful lot of work that people are doing. So it's a supportive tool to provide us with accurate information from the regulator that I think people in this country would expect. In relation to the NTPF, they're the administrators of that scheme. I don't expect or wish that scheme to be bureaucratic. Obviously, there are certain checks and safeguards that need to be in place. I know there was meetings due to take place today and yesterday, perhaps in relation to that, or certainly in recent days, ongoing engagement between officials, the HSE, the NTPF and nursing home representatives. And I'm due to meet Nursing Homes Ireland again tomorrow in relation to this. And the final two questions, I thank you for your comments in relation to the leadership being shown by Ireland in relation to research and diagnostics and other things in that space. I want us to remain in that space. We've appointed Professor Colin Bergen to head up a research group in relation to COVID-19 in our country. We've also carried out one of the first health technology assessments by HIQA in relation to new testings that may become available, so that Ireland can be ready to avail of any of these in the future. And finally, just on the issue of extra staff for our nursing home sector, I know this is a very important matter, a very sensitive matter. The unions were brilliant, all of them, in agreeing a voluntary redeployment scheme, but it is tough, and I've got to concede that. It is tough to I suppose, match appropriate staff to appropriate settings. We've already, I think, seen 61 directly employed staff move to the private nursing home sector. I expect that number to increase, and the HSE is due to give a census update on that this evening.
Thank you. Just also just to put pressure on for the development of our second cath lab, that we advance that to a construction tender, if you please. It's been lying around now for quite a number of months. Thank you.
I'm very eager for that to happen. Obviously, the current restrictions in terms of work and the likes is an impact, but I am very, very eager for that second cath lab to proceed in Waterford.
Thank you.